How can getting gastric bypass surgery affect mental health? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and this is a question that's come up a few times on my page, and so I think it's something worth dedicating a video to. So gastric bypass is just one of several different bariatric surgical procedures that can be used to treat obesity. So I'm not specifically talking just about the bypass, but about any of these procedures like the band or the sleeve that change your anatomy with the goal of helping someone to lose weight. So there are a number of ways in which this can affect someone's mental health. First, let's talk about just the mental health in and of itself. There can be potential positives and negatives. So as far as the positives, of course, if someone's weight has been a significant issue as far as their self-esteem and struggles with food addiction or other food issues, then this can be a significant help. And if someone's able to get down to a healthy weight, they may be better able to exercise or spend time with people, do more active things, all of which may have positive impacts on their mental health. That being said, there is a reason that people have to go through a rigorous psychiatric or psychological assessment before they get surgical interventions, because there can be negative effects on the mental health as well. So one, if someone is used to getting their pleasure from food and then all of a sudden their ability to enjoy food in the way that they have previously is taken away from them, this can sometimes be a significant loss to people that can result in worsening mental health symptoms. There's just such a significant change in your lifestyle, as well as, at least in the short term, what you may or may not be able to do during the recovery process. This can really be a challenge for people, especially if they weren't quite prepared for it or just not prepared for how quickly it hits them and how it affects everything in daily life after you have this type of procedure. Another thing to consider is absorption issues. So a lot of times when people have these types of surgical procedures, there can be absorption issues either in the short or long term that do require supplementation. And I bring this up because vitamin deficiencies like vitamin B12, folate, iron, vitamin D, thiamine, these can all have a significant impact on your mental health. So it's important that if someone is in this transition period and they're not able to get all of these nutrients from the food that they consume, that they are getting adequate supplementation. And then lastly, when someone has had their physiology changed, the way that our medications are absorbed can also be affected. So in a lot of cases, people need lower dosages, right? They're much smaller. Their systems can be sensitized to different medications. And so I'm more likely to reduce the dosage of a medication or just to be very vigilant about new side effects developing after this procedure. However, there are also other cases where, because of issues with absorption, people need higher doses or more frequent doses. It's important to be in regular communication with your mental health prescriber so that they can adjust your medications if or when needed. So these are just a few ways that your mental health can be affected if getting a bariatric surgical procedure. If you've had an experience with bariatric surgery and it's been positive or negative for your mental health, I'd love to hear about it in the comments below. Additionally, if you're interested in getting more direct resources or content from myself, I do have an email list going and I send out bi-weekly emails. So if that's you, then send me a DM with your email and I'll see you in the next one.